Hi, my name is Sophie Harris and I'm a pregnancy and postpartum psychotherapist. I'm also a counselling directory member. I'm here to talk to you about maternal mental health. So firstly, what is maternal mental health? So this is anything to do with your mental health and your emotional well-being, which is related to pregnancy and postpartum. And this can range right the way from when you decide to get pregnant and before you actually conceive. This may be particularly relevant for you if you have difficulties conceiving. Or it goes right through pregnancy, through your birth, through postpartum and beyond into motherhood. You may have heard of the term perinatal mental health, which technically covers the pregnancy and postpartum period up to a year after birth. But I would argue that maternal mental health issues can affect you at any time whilst you're a mother. So what is going on during pregnancy that can affect your mental health? There are so many changes going on, both physically and emotionally, mentally, as you prepare to become a mother. If you think about all of the huge adjustments that you're making, suddenly being responsible for another human being that's inside you, for your body that is changing, the relationship dynamics that you might be experiencing that are changing, and really a change in lifestyle, but perhaps before you've even got a baby. There is so much adjustment that needs to be done. Often when we may have certain coping strategies that we use to help ourselves feel better, we may be less able to do those during pregnancy, such as exercise, just as an example. So some people might experience a lot of anxiety whilst they're pregnant and either worrying about the future or worrying about the health of themselves or their baby. You may experience low mood and just really struggling to get by, and sometimes that might feel like you're actually feeling more depressed, and each day to day is a real struggle. And then we move on to postpartum, where again you are going through such a huge adjustment and one of the probably the steepest learning curve that you'll ever have in your life. So imagine you're suddenly responsible for a young baby. You're trying to learn how to be a parent. You're making this big adjustment from often working previously or whatever you were doing in your day-to-day, so to being at home a lot more. You are trying to do this on very limited sleep often, and not always, but often. And also whilst you're recovering from giving birth, it's a lot that you're trying to deal with in those initial moments, and that learning goes on. What I always say to my clients is that with every big adjustment usually comes some kind of difficulty. It's totally normal to experience some excessive anxiety during that time as you learn what to do and you're trying to find out how to be a parent. And also it's totally normal to experience some low mood. You've got all of those hormones balancing out. You're trying to adjust to a complete lifestyle change. You may be asking yourself, how do I know if it's something more serious or if I am actually really struggling with my mental health? So, some signs to look out for in yourself is if you are feeling bad a lot of the time, essentially. I always say to my clients, so I believe anxiety, low mood, completely normal and a part of this huge mixed experience, and I always really try to get that through to them. There's nothing wrong with you for finding things difficult, but perhaps if that anxiety or low mood is stopping you from doing the things that you want to be doing, it's causing you a distress quite a lot of the time. And another indicator would be that it's not getting better over time, especially. So perhaps if you were going through what we'd call the baby blues, then that might feel better within a week or a couple of weeks or something. But if you find that you're struggling with your mood long term And again, with anxiety, if that anxiety isn't feeling better over time, then I would certainly suggest trying to get some help. Okay, so I know I'm really biased as a therapist, but I think counselling and therapy could help mums, nearly all mums, regardless of whether you feel that you're struggling with your mental health specifically. This is such a huge transition in your life, and it can always be helpful to have someone to support you with processing your experiences, learning skills to regulate your emotions and support your mental health. But particularly if you're experiencing like lots of low mood, depression or anxiety, then therapy can be extremely helpful. So if you are interested in counselling or therapy and feel that this could benefit you, then there are many therapists available who could support you through this period. I run my practice looking after mums, supporting pregnant and new mums through this transition into motherhood. So you can find me either via my website lookingaftermum.co.uk, or you can find me in the counselling directory. My name is Sophie Harris, and I would love to chat with you about how I could help you.